Hi everyone, welcome back to my YouTube channel. I'm Dr.Yusra, an aesthetic medical practitioner with a background in dental and oral surgery. I have 3 aesthetic wellness clinics, one in London, one in Liverpool, and one in Manchester, and we focus on holistic healthcare, skincare, and skin rejuvenation. On today's video, I'm going to be talking to you about retinols, what to do, what not to do, and how to use it so you get all the benefits and none of the drama. This is a key ingredient that is going to give you the radiance that you're looking for, the plumping that you're looking for, but used incorrectly, it's going to give you burning, pain, and a lot of regret. So make sure that you listen on to understand better how to use a retinol, what a retinol is, how to use it in your skincare regime, and how to get the most out of it. Let's dive in. So what is a retinol? Well, a retinol is a vitamin A derivative. It is a cream or a product, an ingredient that comes from the vitamin A family called retinoids. The strongest retinoid is retinoic acid. That is a prescription item called retinoin or retin-A that you can only get from a medical prescriber. Retinaldehyde is 10 times weaker than retinoic acid or retinoin, and retinol is even weaker or 100 times weaker than retinoic acid. It at the moment can be bought over the counter, but the EU have recently introduced new laws limiting and banning any products to be manufactured from the end of 2025 with retinol of more than 0.3% in it for skincare of the face. So it's important that you understand what that means for you. Now, retinol or retinoids, retin-A, retinaldehyde, and retinoic acid are one of the most researched ingredients available in skincare. Indeed, this has been clinically proven to stimulate cell turnover, to improve collagen production, to fade pigmentation, to treat acne scars, and improve the appearance of sunspots, age spots, and lines and wrinkles, which means this is your best friend when it comes to anti-aging skincare. But used inappropriately, it can cause irritation, burning, discomfort, and peeling. So it's really important to understand what to expect from your cream, how to use it to get the best out of it, and what to do if you do get side effects. Now, some of the biggest mistakes that I see when people are using retinols, retinoids, retinaldehydes is inappropriately mixing it with different ingredients like alpha hydroxy acids or beta hydroxy acids or other skin irritants like, for example, vitamin C, or using the wrong retinoid for the wrong skin condition. For example, retinol, which is the watered down version of retinoic acid, it's like the Ribena version, that can actually make acne much worse. It can make acne angrier, redder, more painful, and more frequent. Whereas retinoic acid or tretinoin is on the National Institute of Clinical Excellence guidelines for the treatment of acne. So that means not all retinoids are the same. And which one you should use depends on your skin type, your skin concern, your underlying skin pathology, and what you want to get out of it. Really, it's very important that you seek professional care so you have a skin analysis before starting your journey on a retinoid, because using the wrong one can make matters a lot worse for you. The second most common problem that I see with people using retinoids is that they are not using a barrier or they're not using a moisturizer, they're skipping their moisturizer. You must always use a moisturizer to hydrate your skin. Even if you have oily skin, you can be oily and dehydrated at the same time. Now, because a retinoid stimulates cell turnover, it pushes all these new cells up to the surface and causes flaking of the dead skin, which means you're going to have peeling, you might have irritation, you might have burning. To a large extent, that's normal. But if you don't know what to expect or you don't know how to mitigate those risks, you're going to be suffering endlessly and unnecessarily. Make sure you are always using a moisturizer. Make sure that you are using a proper barrier protection. Your skin is not just a carrier, it is indeed a barrier. So you need to make sure that you are placing the right moisturizer or the right barrier to prevent irritation or to reduce irritation and to help hydrate your skin, particularly during the use of a retinol. Number 3, I see too many people skip sunscreen. You should never skip sunscreen. Your retinoid outcome and journey will only be as good as your sunscreen journey or your sunscreen use. So it's really important that every single day, come rain or shine, you're using a sunscreen with an SPF of 30 or above, specifically and particularly when you're using a retinoid. Number 4, using it at the right time of day. You should not be using a retinoid in the morning. This can make your skin sun sensitive, and you should only use a retinoid in the evening. So that's another important point to understand when you're using a retinoid. It is an evening only use. And number 5, make sure that you're not using these products when you're pregnant or breastfeeding. Retinoids or vitamin A's can be teratogenic, which means they can actually cause deformities in a baby if you're using it whilst you are pregnant. So you must not use it while you are pregnant. retinoids, and discuss when to reintroduce it after pregnancy if you want to. Let's get practical about how to use a retinoid and when to use it so you know exactly how to get the best out of this product. Number one, the first step in using the right retinoid is ensuring that you are using the right ingredient and at the right strength. They are not all made equal and they are made for different skin concerns. For example, adapalene is a retinoid made for patients who have acne. Tretinoin is also useful in patients who have acne, but is also on the gold standard for the treatment of hyperpigmentation when combined with hydroquinone. Retinol, which is one of the weaker versions, may be more suitable for those who have sensitive skin or who want to just start out or who are postmenopausal and their skin's a little bit drier, they want to build up tolerance. So which ingredient you use and at which strength depends on your skin concern. If you don't know and don't have access to a healthcare professional, and on the basis that you don't have an inflammatory skin condition like rosacea or acne, then you may be suitable for a retinol that you can buy over the counter. Start slow and start low. I would go for a retinol 0.3% or a retinaldehyde on a weaker version. Step 2, use it at the nighttime only. Don't use it in the morning, use it at nighttime, and then you can use it towards the end of your skincare regime just before the application of a moisturizer. Number 3, try the sandwich method. The sandwich method is a fantastic method that really is game-changing when it comes to retinoids. What I recommend to my patients that are particularly sensitive or who want to avoid irritation, peeling, or burning is do this. Number 1, place a layer of moisturizer on your face. Number 2, apply your retinol. Number 3, apply another layer of moisturizer. This creates a retinol sandwich where it's layered between 2 layers of moisturizer. And this really helps to reduce or buffer the penetration of the retinoids so you get less irritation and you're comfortable throughout your use. Number 4, my advice is start slow. When you are applying your retinoids, for the first week, use it once a week. Second week, use it twice a week. Third week, use it 3 times a week, and so on, building up until you can tolerate it every night. That way, you start to get the benefits without the irritation and downtime. And number 5, pair it with a barrier skincare. Something like niacinamide, ceramides, hydrators. These really help to improve the hydration of the skin and make you comfortable throughout the use. So here's some of my favorite retinol products or retinoid products. Number 1 has got to be tretinoin. I think that this is a turbo boosted product. This stands the test of time and it is really truly the racehorse of all retinoids. But it is strong and it's on prescription only. So you need to see a medical prescriber to see if it's suitable for you and to decide what strength to prescribe. My next favorite that is a retinaldehyde which can be bought over the counter is the Alpha Ret Skin Better Science. This is a retinaldehyde that it's encapsulated. It also has other hydrating ingredients like ceramides and lactic acid and hyaluronic acid that help the penetration of the product and help to improve the skin and rejuvenate and hydrate at the same time, so you're not suffering as much as if you weren't using any hydrators. Number 3, the Medicate Crystal Retinol. This again is a retinaldehyde and you can choose to start very, very slow and build up slowly. My only comment on this particular product is sometimes it can take a really long time to build up to the desired and really powerful product, and you don't always have to go that slow. If your skin can tolerate, go stronger because you want to get the best out of your product. Number 5, Obagi Retinol. This is an encapsulated retinol that comes in 0.5 or 1%. It's very effective. It's encapsulated, so it's slow release, and it really helps with patients who have sensitivity to the skin, want to build up their tolerance, but also want results-driven treatments. And ultimately, why are you using a product? Because you want results and you want a clinical end outcome. So that is my top tips on how to use a retinol, which one to use. I hope you found this video helpful. If you know anyone who's thinking about starting a retinol, a retinoic acid, tretinoin, retinaldehyde, and can't really pick which one, this video is for them. Make sure you share it with them. Save this so you know exactly how to use your products. Don't forget to try the sandwich technique, and if you have any questions, drop them below. Remember to like and subscribe, and I'll see you in the next video. Bye.